rheumatic fever, we have to manage him in the line of autoimmune pathologies. And our skin area today is important. Erythema marginatum is the feature. Already diagnosed case of rheumatic fever with a prescription will come with diagnosis, erythema marginatum. We won't have much thing to do, but first hand diagnosis is plaque with non-pruritic erythematous cercinate, that is round lesion with the clear border, and the center area will be clean. There won't be any feature in the center, but there will be a whorls-like presentation, and there will be erythematous but non-itchy plaques. Non-itchy plaques are very rare. If we see psoriasis, there will be itching, and if we see lichen planus, there will be severe itching, but it will be erythematous and plaques. But here it will be non-itchy. RA, I need not explain. We are all very familiar with this condition, and it's a dermatological area we have to see today. And out of this, the most common is the nodules. Nodular swellings will be there, and there will be vasculitis also, which develops purpura over the skin. In a chronic case, very rarely pyoderma gangrenosum. Pyoderma features will also be seen. Dermatomyositis. Dermatomyositis is seen as purplish red or erythema, which is discrete. Heliotropic erythema, which occurs on the face, especially involving the eyelids and upper cheeks, and foreheads and temples. And there will be edema over the periorbital tissue, and flat papules or Gottran's papule is the name for that lesion. It will be small, hyperpigmented, reddish, and it will be spread all over, and it will be flat but papular lesions, which is seen all over the joints, usually on the extensor surfaces of the fingers. Next is scleroderma. At first, the lesions are indurated, that is, that will be very deeper, and they are faintly purplish, and which later they lose their color, especially in the center, and they appear as thickened waxy areas and smooth and shiny. The hairs are usually absent over the surface. Scleroderma are common here, and they are a little bit fast in its progress, and they are usually very difficult to manage by simple OP medications. They need admission. They need Vataja management. The lesions are indurated and they are purplish. They lose their color in the center and appear thick and waxy areas will be there, which are shiny in nature. Next comes the patches of hardened skin appears over the face, hand and feet, which lacks sweat gland and ability to make the skin fold. Skin folding will not be possible. We cannot create the wrinkle or foldings on those areas. It will be very hard. Raynaud's phenomenon is a common finding in the case of scleroderma.